Hey guys, Dr. Ben Galyardt here, author of the book, Rebuild Your Brain, Stop the Damage, Start the Repair. And today I want to go over what functional medicine is. This is a word that's been getting thrown out all over the place now. People are talking about functional medicine, alternative medicine. They're looking at other ways to help their body, and functional medicine is one of those thoughts. This term was coined back in the 1990s by Dr. Jeffrey Bland. He also is the doctor that coined the term leaky gut and came up with the 4 R's of how to repair, rebuild, renourish the gut lining. And amazing doctor, done a lot of training with him in the past years. So functional medicine is different than a lot of other things out there as far as alternative medicine or natural medicine, things like that. The idea on functional medicine is to come in from that underlying premise of why. Why is this happening? And I have patients every day come in and they're like, thank goodness somebody's looking at that why. They don't want just to take melatonin if they can't sleep. Melatonin's natural, but that's not the why they're not sleeping. They don't want to just take an enzyme to get their digestion better. They want to know why that digestion is off. Is it the vagus nerve coming out of the brainstem that's not giving peristalsis, that's not affecting the sphincters appropriately in that digestive tract? And we can't just do some kill off. We can't just do a probiotic. We can't just do an enzyme. We got to figure out that why. Why is this actually happening? So that's the fun part, where we're able to take a step back and say, okay, you know what? You've got this thyroid issue. You've got this whatever diagnosis, but why is that going on? So for me, when I sit down and do an in-depth neurological metabolic exam, I don't even look at the patient's history. I don't look at their what they've been diagnosed with, what their history has been, where they've gone, who they've seen, what they've tried, because I want to take that global perspective. I want to look at that body as a whole, not be skewed and saying, oh, you know what, I was diagnosed with this one thing right here, so then we get out that little scope and say what is going on in that one spot. I want to see what their eye movements are doing, what their gag reflex is doing. Do they have a capillary reflex in the fingers and the toes? All these different areas. Can we tell what's actually going on in the body? Are they anemic? Why? Why are they anemic? Sure, we can give you iron, and we probably do need to give you iron short term, but why is there anemia? And that's the true definition of functional medicine. Let's take that step back. There is no protocol. If you've got a thyroid issue, you walk into the doctor's office, and this is a natural or alternative practitioner, and they say, I've got the best thyroid protocol possible for you. What are we going to do? Well, we're going to do this, we're going to do this, we're going to do this, we're going to do this. Well, that may be fine for one person, but for another person, even with the exact same symptoms, it might be a totally different process that we come up with. There is no protocol except the protocol for you. And so that's why we look at the underlying imbalances. We look at blood sugar, and we do blood sugar monitoring and food diary, and we'll take foods out, add foods back in, do a lot of different things to figure out that underlying why. Why is the body going haywire? Why is the brain being affected? Why does somebody have anxiety, depression? Any of these different issues that we get, rarely is it just a biochemical issue. Rarely is it just a neurotransmitter imbalance where we say, hey, take this natural brain thing and it's going to fix it. Usually somebody takes something, whether it's natural, synthetic, they get off and it comes right back because they didn't address that underlying cause. So functional medicine, this is truly the cutting edge of helping somebody. I'll tell you this, there is never a silver bullet for helping somebody with whatever thing they have. If there is, then it really wasn't that big of a deal, and if they take that one little enzyme and their digestion is fixed, there wasn't a big problem. Most people that come in, they have issues, and we have to do a silver buckshot. So just like a shotgun, we hit multiple different areas, and by the time we're done, they've had significant changes, and we go from there. So just a little tidbit, a lot of people are hearing those buzzwords. We get a lot of patients calling in and say, hey, I heard this person talking about functional medicine, that person talking about functional medicine. There's a significant difference between that philosophy and just natural medicine, alternative medicine, any of these other things. So if you're looking to get work done with somebody, ask them these questions, ask them about the things that we've talked about today. So hope you guys have a great day, and we'll talk soon.